Choosing the right therapist can be a daunting task if you're new to therapy, but also if you've been in therapy before, but you want to find someone who's a better fit for you. I have over 30 years of clinical experience as a social worker, so I've had lots of opportunities to talk with clients that are new to therapy, but also those that are looking for a change. So today I'm going to share with you 2 essential factors that I think you need to understand so that you can make the best choice possible in the therapist you're going to work with. Now is always the time to start making positive changes in your life. Dr. Donna Leigh Bliss here. On this channel, I promote optimal mental health and well-being to help you become the best version of yourself. In this video, I'm going to talk with you about 2 essential factors I think will really help you make a good decision in finding a therapist. I'm also going to talk about questions that you can ask to help find the right person for you. So I call these 2 factors the 2 C's. The first C is competence. Obviously, you want to find somebody who knows what they're doing. Have they had experience as a therapist? How long? What is their educational background? So to have confidence that somebody can help you is very, very important. But I think it's easy to take that for granted and not really understand the importance of talking with a prospective therapist to help determine whether they're competent or not, especially in the area that you're looking for therapy. So for example, let's say that you have a trauma background. You might talk to a therapist who's very skilled in dealing with depression or anxiety, but they may not have as much experience dealing with trauma. So they wouldn't necessarily be a good fit for you. So here are some questions that you can ask a prospective therapist to help you determine if they're competent. Question 1 is pretty straightforward. It's asking somebody about their educational background. What did they get their degree in? Was it a master's degree, a doctorate degree? The second question is, what interested you in studying this subject area? So sometimes I have prospective clients ask me why I became a social worker, and I tell them the story about how originally I was going to become a clinical psychologist because I'd always been interested in psychology. And then in my senior year of college, I was talking to somebody about what my career goals were, and somebody said something to the effect of, have you ever considered social work? And I hadn't. And that just sparked interest in me, and when I studied the profession, I like social work because it's very holistic. It looks at the person in relationship to their environment, other relationships, but social work also has a strong social justice focus. So those 2 considerations are important in why I've chose social work over psychology. Question 3 is regarding what is your licensure status? There are typically different levels of license, at least in social work. And the first level you get after you get your master's degree, but to be an independent practitioner, you need to have at least 2 or 3 years of supervised experience. So it's important to understand what license level they have. So for example, I'm licensed in several states, and I'm a licensed clinical social worker, which is the highest level of licensure you can get. Question 4, again, that's a straightforward one, is asking how many years you've been working as a therapist. Now, just because somebody has more years doesn't necessarily mean they're better, but it does give you an idea that they may have a lot of practice experience. But I wouldn't rule out somebody that is younger in the profession. They might have cutting-edge information that you would find helpful, so I think you want to understand their perspective too and how many years they've been working. Question 5 is to ask them what main issues you focus on in your work with clients. Some therapists like to specialize in certain issues such as anxiety or depression. My background initially was in the addictions field, and it branched off more into mental health and trauma. Question 6, what is your treatment philosophy? Now you might not ordinarily think of that as an important question, but it actually is. Because it helps you to understand how a therapist sees change happening. So I have a treatment philosophy that's very direct and solution-oriented. It's client-centered, it's practical. I think talk therapy can be helpful. It can be cathartic. It can help us feel that we're not so unusual. But I don't think that talk in and of itself is sufficient to be able to make the kinds of changes we need to make. So understanding somebody's philosophy is something you might find helpful, realizing that there isn't a right philosophy. It's really just a question of which one you feel is a better fit for you. Question 7 asks about what therapeutic approaches do you use? Now, sometimes therapists say they have an eclectic approach, which means they favor different approaches, not just one over the other. So I use cognitive behavioral therapy quite a bit because I find it to be very practical, very effective. But I also use psychodynamic therapy as well because I think that can be helpful, especially with dealing with unresolved issues from childhood. But when I work with clients that have trauma backgrounds, I use a trauma-focused approach. So I don't favor any one approach over the other. It really is what approaches work best for a given client. Question 8 asks, what is the rationale for the therapy that I use? And it's evidence-based. So cognitive behavioral therapy is considered a gold standard. It's been studied a lot. There's tremendous amounts of research that has demonstrated how effective it is with many issues ranging from anxiety to depression to stress management. And so it's something that many therapists use. Number 9 asks, what are the goals of therapy? Ask therapists, do they have a specific time frame they're working with or a number of sessions? How are they going to assess making progress? What happens if you or the therapist doesn't feel like you're improving? Do you talk about it? Do you just end therapy? Do you make changes in the approach? So that actually is a particularly important question, I think, to ask. And finally, question 10 asks about confidentiality. Are the sessions confidential? How is that confidentiality assured? Are there limitations to confidentiality? So note that these questions will give you specific information on the level of competence of a particular prospective therapist. Now, you might find it daunting at the idea of asking all 10 questions of someone, so you can narrow down the ones that are most important to you. But having a good baseline understanding of somebody's level of competence is very important, and it goes a long way in helping you feel confident in your decision making. So the second C is caring. And this is a little bit more challenging because it isn't as black and white as establishing competence, yet it's critically important. Research has shown over and over again that what helps the most in therapy isn't necessarily the therapeutic approach, although that's important. It's the establishment of a therapeutic alliance. It's the feeling that a therapist cares about you, that they have empathy, that they're not judging you, that they're supportive of you. And that caring has to be genuine. And when you pick that up and you actually feel that connection with a therapist, it can already start to help the healing process. So really talking to somebody and getting a sense of, are they warm? Do they listen to you? Do you feel heard? Do you feel that they really want to work with you? And make a determination whether that is a good fit for you is very important to do. So with over 30 years of clinical experience, working with clients with many different issues, I've seen over and over again the importance of competence and caring, and how when clients feel that they're cared about, when they're confident that the therapist knows what they're doing, that they can make amazing transformations in the quality of their life. So I encourage you to think about the 2 C's. Think about the questions that I suggested under competence and which ones are most important to you. And so when you're talking with somebody, ask them the questions. A good therapist is not going to feel bothered. They're not going to be uncomfortable because you're asking them straightforward questions. It's important to do that because that information is very helpful. But finally, once you've done that, you really want to establish whether you truly feel cared about. And when you make that connection, you can be confident that you've made the best decision you can about the therapist to work with and feel confident in your work going forward with them. Thank you for watching this video. I've included some helpful resources in the description below. Please click on the subscribe button so you can be notified when upcoming videos are released. I've also included links to 2 other videos that you might find very helpful. Remember, now is always the time to make positive changes in your life. I'll see you next time.